So with a show of hands, can you tell me how many of you know someone that has suffered stroke? Okay, so I see a few of you. So as you can see, stroke is a very common disease in our society today. In stroke, it is a consequence of reduced blood flow. And in stroke, there are only two things that could happen to a vessel. A vessel could either be broken, that results in bleeding or hemorrhaging, or it can be blocked, which results in ischemic stroke. I am particularly interested in ischemic stroke. In ischemic stroke, the heart or the carotid artery sends these blood clots, or as I call them, evil packages, to the brain and blocks them. My master's thesis focuses on understanding what these evil packages are composed of. The reason I'm so interested in composition is essentially to understand why some of these clots are not receptive to treatments. And we predict that there's two reasons for this. One is a process called endothelialization, where you have these endothelial cells that cover up these clots like a blanket. And two is because it traps elements and metals within these clots, making them so dense that no clot-busting drug can get in to break it. In my project, I'm using a novel, sophisticated technique called X-ray fluorescence imaging to see how these elements are trapped within these clots and how are they distributed. This technique is carried at the synchrotron, which is the only synchrotron on Canada, so we are very proud of that. And what the synchrotron does is it has charged particles that accelerate close to the speed of light. And as a result of their acceleration, they produce a bright light. And I use this bright light to visualize what my samples are made of. So why should we care about stroke in general? Well, every year in Canada, there are 50,000 new stroke cases, which means that there's one stroke case every 10 minutes. Economically, it costs the Canadian economy $3.6 billion every year in stroke services. And above all, it causes the stroke victims to have long-term negative impacts. It's a shame that the brain dies before the clot dissolves. The clot dissolves generally within a week or so. But what's the point of treating a patient if the brain has already been dead? And I'm hoping that my project could turn this around. By understanding the composition of these clots and identifying right targets to break these clots in a time-efficient manner, we're hoping that we could minimize this damage. This concludes my presentation. I would like to thank everyone for listening to my presentation, as well as my supervisor and all the funding agencies. Thank you so much.